Hi, I'm Nurse Barb. I'm a women's health nurse practitioner, and this is your daily dose on end of life and hospice care. Well, if you're watching this video, chances are you have a loved one who is facing the end of their life, and you're thinking about the best ways to help them at the end of this journey, to help them be more comfortable and to not suffer. Many people think that hospice is only for the last few days or the last couple of weeks of someone's life, but I want to reassure you, hospice care can be used for 6 months sometimes, and it doesn't mean it's the end. It doesn't mean that you're giving up. That's one of the misconceptions that I'm always talking to my patients about. Even though I do women's health, many of my patients are caring for an elderly loved one in their homes, and they're wondering about hospice, what does it mean, and whether or not they should access it. One of the most important things I can tell you is don't wait until it's the last few days or the last week of someone's life to use hospice. Again, it doesn't mean that you're giving up, but hospice care helps you provide care that's compassionate, that helps reduce pain and helps your loved one feel more comfortable. I was fortunate enough to take care of my mother, my father-in-law, and my grandmother through hospice, and I also helped care for a few friends who were being cared for by their family members. So I've been through hospice care at least a dozen times with friends and family members, and I can tell you this, most people wait. They wait too long because they think that when they start hospice, it means they're giving up. What it means is that you're not giving up on the person, you're not throwing in the towel, but you are accessing a different level of care in your own home or in a private hospice facility where a person can maximize their life, they can maximize their enjoyment. And that's because when you use hospice, the providers come to you, they work with you to make sure you're keeping the correct medications for your loved one, maybe not using medications that are no longer needed, and adding medications that may help reduce pain or anxiety. I know when my mom started hospice, we started using more oxygen for her, and it really helped her be able to interact with all of us. It helped her feel a lot better, and she wasn't as anxious. For my father-in-law, we used other medications so he wouldn't be as anxious, but he could still talk and be involved with the family. The other thing that hospice provides is a lot of emotional support for family members, because after all, you need that. It's so difficult to see a loved one in the final stages of their life. But hospice providers are all trained to help with communication, gentle communication, and help you work through some of the grieving as you prepare to say goodbye to a loved one. Not all deaths are easy. Not all deaths are comfortable, but by accessing hospice care, you can help ensure that your loved one will feel as comfortable as possible for as long as possible. And I know a lot of hospice nurses sit down with family members and go through sort of a step-by-step what to expect after they evaluate the loved one. And they also give you a lot of guidance on the types of medications that are available, when to use them, and when to call. That's the other thing about hospice. They're available 24/7, even on holidays. And again, they come to your home to help you as you're caring for a loved one. In addition, with hospice, they're able to order the equipment that you may need and that you may have had trouble getting access to. They can also help with arranging for other healthcare providers or healthcare workers that can come in to help with this caring. I remember when my mom was going through hospice, it was really nice to be able to talk to the nurses about the amounts of medications that we would need to reduce her pain, but to also check in and ask about the confusion that she was having. What was it caused by? what could we do to lessen that for her? And what can we do to lessen her pain and some of her suffering? And it's also important because so many times when a loved one is nearing the end of their life, one or two people in the family become the expert. They become the primary caregiver. And then all the other family members are coming to them for advice and for expertise. But that places a huge burden on that family member. And it's a good idea if you're using hospice or palliative care to defer those kinds of questions and those kinds of explanations to the professionals. The other part that's helpful is that most families who go through an end of life with a loved one have some issues that maybe haven't been resolved yet. And that's where you have the opportunity to talk to people who've been through this with other families before. Understand that everyone needs to be heard. Everyone needs to have their voice heard and talk about what's happening with the loved one so that everyone feels like they're in this together. It's also completely normal and natural for people not to agree about how to take care of someone at the end of their life. And again, that's where hospice and palliative care can come in to help families reach agreements so that once a loved one has passed, there's less resentment and there's less anger or bitterness, which can unfortunately happen. When it comes to end of life, so often we don't have the words that we want to say to our loved one, and that's an area where you can also access help from the hospice nurses who come to your home and can help you be able to communicate to a loved one some of the things that you need to say so that you can say goodbye and so that you can have that opportunity to what we call come to closure or come to completion. You know, it's very, very difficult because everyone has a different relationship with this loved one. Everyone is going through their own things, so we can't expect that everyone will want to do the exact same thing. I also want to say that when it comes to caring for someone 24/7, it's really important that you care for yourself, that you be as kind and nurturing to yourself as you are to your loved one. And that's because 24/7 caregiving is exhausting. It's also very normal for you to feel resentful if you're doing all of the sort of heavy lifting and you're doing most of the caregiving. It's a very normal and natural response because this is very difficult. And it's even worse if you're trying to hold down a full-time job or you're taking care of other family members like small children, or you're trying to take care of your own family at the same time. Many people feel like their whole worlds revolve around a loved one and their passing, and that's also normal and natural. But I'm going to encourage you, as a former ICU nurse, take some breaks, even if it's 5 or 10 minutes. Do something that recharges you. Go for a walk, even go outside for a few minutes, breathe in some fresh air, have something in your life that you enjoy. Maybe it's a longer shower, maybe it's a food or beverage that you really like, so that you can go back and be the person you want to be for your loved one. And finally, let's talk about guilt. We all have guilt. We all have regrets. It's important for you to try to process that before your loved one passes, because afterwards it makes it much more difficult for you. So try as best you can to forgive yourself for not being perfect all the time. Forgive yourself for anything that you may have done that you're not so proud of, maybe things that you've said. We've all been there. We've all done it, especially when we're caregiving. So I know this is a really difficult time for you, and I'm sorry that you're experiencing this. I hope that you'll access hospice or palliative care early so that you can get the benefits from it. And also remember, sometimes when people go through hospice, we say they graduate from it. They actually perk up. They actually do better. They get a second or third wind and they go on to live for several more years. So this is not giving up, but I hope you'll access the care that you have available through them. I hope that this has been helpful, and if so, please click like, and you can always subscribe to my videos. And of course, for more information, you can go to nursebarb.com. Take care, be well, and be kind to yourself.